So today we are very graciously welcomed by St. Joseph Hospital. Now, St. Joseph Hospital is a sponsor for Out to Lunch. We thank them so much for sponsoring today's show. Out to Lunch, they've been very active in the community, as they are, of course, St. Joseph Hospital. They're now a proud member of Prime Healthcare. They want to ensure that they give you that high quality care that you need. And they are here to talk about a program that they have featured. So I want to welcome both of our guests today. Thank you so much for joining us today. How both of you doing?
We're great. Thanks for
Awesome.
having us.
Thanks for having us.
Of course. Thank you for joining us today. If you want to do a little introduction on yourselves and your position at St. Joseph Hospital.
My name is Beth Welke. I am the Quality Improvement or Performance Improvement Manager, Quality and Patient Safety.
My name is Maria Suvacharov. I'm the Chief Nursing Officer. In case you're wondering where my accent comes from, I'm from Macedonia, a small country just north of Greece, a Slavic accent.
Very good. So again, folks, if you want to tune in, you're listening to WRMN AM 1410, broadcasting live here from Studio 14, serving you, the Fox River Valley area. Now, St. Joseph Hospital does have a program here, and it's a stroke program. So tell us a little bit about the Stroke Center and what you have to offer to patients in need, just kind of a general basis.
Sure. So, about 1 in 6 cardiovascular deaths that happen in the United States are from stroke. And we understand that this is very important service to offer to our community. So, what we have done, we have joined forces with the Joint Commission, which is accrediting body for hospitals, and we have received special certification in stroke care. That program dictates or is asking us to follow certain guidelines, evidence based practice, standards, measure specific things that all have been shown that if we do these certain things, the care that we provide for our patients will be the best care that there is. So we are primary stroke center. And as such, like I said, we follow very strict guidelines, how we receive patients, what we do with the patient from the first sentence to the emergency department, the care that we provide in the emergency department, care that we provide on the units as well, and how we discharge those patients.
So tell us a little bit here too. Can you walk us through the dedicated stroke focused program at St. Joseph Hospital, how it supports patients from the moment they arrive in the ER through the recovery process?
So, fortunately, we are EMS or Emergency Medical Service Training Center through the Department of Public Health. So, we train some of the paramedics that serve our community. But stroke care really begins at home. It begins when people recognize those symptoms at home and they call EMS because EMS can notify us before they get to us. So that's really one big message that we would like to get out. And then when they arrive to our facility, they are, greeted by our emergency room staff. We have what we call a launch pad right outside the EMS doors so that they can be quickly evaluated and assessed and determined to get them to the CAT scanner so that they can have a CAT scan to see what's going on, to make sure that they don't have something acute like a bleeding episode in their brain. We have nurses, physicians. We have a stroke coordinator who follows our patients and reviews all of our processes to make sure we're doing the latest and greatest and sees if there's any areas of opportunity. We work really hard on making sure that when the patient arrives to us, they are scanned within the first few moments of arrival, and then we can assess to determine what their individual needs are.
You probably have heard of the term saying time is brain. And that means the quicker we can help those patients who have a blood clot in their head by giving them medication that can dissolve the blood clot, the more of the brain function will be preserved. And the magic number is between 3 and 4.5 hours. If patients present to us with the first onset of symptoms within those 3 hours, and we are able to administer them the medication, it's called TNK, we actually are able to have a really awesome results. We have patients who come in and they are not able to talk and they have a facial droop and a weakness on their arm. And as long as they're within those 3 hours, we give them the medication. That transformation is almost immediate. It's amazing to see how now their facial droop is coming up and they can actually move their arm a little bit better. So that is a message we want to give to the community. If you are experiencing anything that's off, you may be having a little tingling in your arm, or maybe your face is drooping a little bit, or your speech is slurred. Don't wait for it to get better, because that's what we hear a lot. Oh, I'm going to wait a few hours to see if it gets better. A few hours is too late. Just call 911 and come to the hospital. Do not drive yourself. Call 911 and come to the hospital because the stroke care can come start even in the ambulance. They can activate the stroke team. We will wait for you right on the ambulance bay. We will rush you back in the CAT scan right away. And the goal is to give you the thrombolytic agents, which is a medication that dissolve the blood clots within 60 minutes of arrival.
Awesome. Beth, I know you were going to say something as well.
I was just going to reiterate, trouble word finding. Some things that sometimes we think they're benign and we ignore them or we don't pay attention. Numbness that doesn't go away, clumsiness, just things that you think, oh, I'm just having a bad day. Sometimes they can lead to something bigger. And while you're at home waiting for them to resolve on their own, it's precious time because time is brain.
Absolutely. Now, of course, you wouldn't be able to do what you do without strong teamwork and adequate training. So, how are the medical professionals at St. Joseph Hospital specifically trained to provide advanced stroke care, and what ongoing education do they receive in this training process?
We're very structured about it, actually. Every single new clinical employee that gets onboarded gets stroke specific education about the guidelines, about the standards, about the expectations, documentation expectations, care expectations. Same thing with the providers as well. They receive education. The core group, the core stroke group, is mandated to receive between 5 to 10 hours every year on continuing stroke education. In addition to all of that, every single employee of the hospital gets basic stroke training. So when the EVS walks in a patient's room and they may be seeing the patient is having facial droop, they can actually empower them to be able to call the nurse, call the rapid response, and eventually call the stroke alert. Because we do know, like I said, time is brain.
Absolutely. And that training is there for your ensured quality experience so that you can get to what you are needing, especially when it comes to that care too. And again, that's team and training. And then, of course, there's also certification and standards. St. Joseph Hospital is recognized as certified primary stroke center. I mean, what does that mean for St. Joseph Hospital? How does that certification impact the quality of care that patients receive?
Sure, go ahead.
So, in working with the American Heart Association, best practice research, and then the Center for Medicare and Medicaid Services, they establish guidelines of the best practice and what minimum care that everybody needs to receive. So they hold us to that standard to ensure that patients are protected from having blood clots, to ensure that they're evaluated to need to be on a cholesterol lowering agent, to make sure that that lab test is done, to make sure they go home on it. And then quite often, patients who have a stroke have some sort of cardiac arrhythmia where they form clots. They need to be on a blood thinner so that we can prevent clots from happening again.
So we, like I said, we partner with the Joint Commission on this, and they actually visit us every other year to look at our program, to evaluate it, critically examine it, and look for opportunities for improvement for us. In the meantime, we report to the Joint Commission every month our metrics. What percent of patients receive their TNK within 60 minutes? What percent of patients received prevention for blood clots in their legs? Or what percent of patients receive medication for cholesterol? So reporting this monthly, we are trending it, and if we are finding any issues, we have to develop an action plan around it. How are we going to improve the specific metrics, and then submit to the Joint Commission again? They review it. They may have constructive criticism for us. So they're partnering with us to ensure that our program truly delivers the best possible care that is out there.
I like that you did mention about ensuring that about statistics and getting that report in and then analyzing it and saying, okay, what have we done correctly? What can we do a little bit differently? And I know that for each stroke patient, it's going to be a little bit different for everyone too. So again, it kind of goes back to that training side of things of knowing generally like, okay, this person might be put in this maybe specific category. And so we're going to make sure that they get the help they need based off of our training and how that is for them in particular.
And then depending on where the stroke happens and what part of their brain, what is the effect of the stroke. So we have a rehabilitation team, make sure that they evaluate them and see what their needs are. Because just because you look okay on the outside doesn't mean maybe something's not connecting and you're having difficulties speaking or articulating your needs or your wants. It's called expressive aphasia. And it's frustrating to the patients, but therapy can help train them a different part of their brain to take it over and work appropriately.
So in addition to having, partnering with EMS where we train them, on the best guidelines, so they can do that pre-hospital care, then the emergency department, then the inpatient nursing units as well. We have acute rehab. A unit in our hospital as well, and most of our strokes patients actually go there. It's interesting thing is that most insurance companies will approve that acute rehab setting because they know it truly does work, truly does decrease the morbidity or the side effects that patients have. They can teach them to use their arm or some adaptive devices that they may need. And that department really does an awesome job with helping with the rehabilitation of stroke patients.
Awesome. And again, yes, so there is timeliness of care as well too. Again, stroke care is very time sensitive. So your team, of course, has to ensure that rapid diagnosis and treatment for patients arriving with stroke systems. And so how do they, I know that we did talk about how they do that as well. Is there anything a little bit more that goes into that with the timelessness of care, with it being so time sensitive? When it comes to stroke symptoms, I mean, I know you had said generally it was, I think you said 3 hours?
Between 3 and 4.5 hours.
3 and 4.5 hours.
Is the most optimum time. If you come to a hospital within 3 hours, we can definitely give you the medication that will help you dissolve the clot. 4.5 hours, some people may not qualify if you're outside of the 3 hour window.
Okay.
So we are asking, there's this Be Fast acronym that the American Heart Association has put down. B is for balance. If you have lost your balance and this is new for you, think about stroke. If you have a vision changes, that's the E stands for, think about possible stroke. If you have face drooping, the arms, A is for arms, and S is for speech, and then time, call 911. We would rather you come to our hospital and we'll say, no, you don't have a stroke, you're good to go, fantastic, But if you come late, that becomes problematic for us. So some of the other things that we do for timeliness, we announce code stroke overhead. So that hospital knows that we have a patient, that we need to free up the CAT scan for this patient, that the ICU team needs to be prepared, for to receive this patient. The ED doctor knows that they need to look at this patient. Pharmacy needs to know that they need to profile the medication that we need for delivering a radiology, gets the information they need to read this CAT scan fast. So that alert kind of puts everybody, I hear that alert in my office as well, So that alert is something that puts us all on, okay, we need to really work extra expeditiously to make sure we provide the best and the most timely care for this particular patient.
Absolutely. And you already answered my next question, which was what are some things that people can recognize if they might be having a stroke? And you talked about Be Fast.
Yes.
With
Used to be just FAST just a few years ago, but
Mhm.
I don't know when they changed that, maybe 5 years ago. Now it's a
I think
Be
so.
Fast. There's a really big focus around stroke with the American Heart Association because we can prevent the comorbidities. We can prevent the side effects, and decrease the disability that people have if we do timely care for these patients.
Absolutely. And again, that particular BFAST chart is available online for you to check out. I do recommend printing it out for yourself and looking it over and knowing, okay, is this something that I might be going through, like you said, for the first time?
Mhm.
That might be a sign of a stroke. Don't wait. It's important. Better safe than sorry.
Absolutely.
And quite often, EMS or the physician will ask whoever's with the patient, when's the last time you saw them? When was the last time they were okay? And that's kind of our time that we take.
That's type 0, where
Yeah.
we count the 3 hours from. So, and more often than not, and we really need to fix this, as a community, more often than not, the stroke patients don't come up to us for at least 24 hours, sometimes even
Because
longer
they
than
think
that.
it's going to go away.
Yes.
Yeah.
I'm just older and I'm weak and I just don't feel good today, and I'll get better if I just lay down and don't do that.
Absolutely. That goes into, of course, the importance of community education. What efforts does the hospital make to educate the Elgin community on recognizing the signs of stroke and the importance of seeking immediate treatment? Again, we did talk about the BFAST chart here. Is there any other community educational efforts that you take?
We have had our stroke coordinator go out to community events. One year was the King County Fair, the Friday afternoon farmers market. Sorry, I'm pointing to where it is, not necessarily.
Where it is.
so that they, can be present and be available to ask questions. And then we do have some like little business card things with Be Fast on it. So people have that, they put it in their pocket or their wallet, a wallet card maybe to remind them, oh, maybe I need to do something about this if they start to exhibit symptoms.
We had back to school event at
Oh,
the
yeah.
library.
Forgot about that.
Where we had dietitian educate the whoever attended it about healthy life habits, and preventing cardiovascular diseases, because that's what stroke is, cardiovascular disease actually.
Absolutely. So, folks, it's very important to attend these events if you can. A great way to get educated, and especially if you or you know a loved one who might be going through these things or maybe having these questions, it's good to definitely get checked up for sure. Again, you do collaborate a lot here too. The stroke program collaborates with other departments. And how do you do that? So, with other department specialists and community partners to provide that comprehensive care.
So, like you mentioned earlier, EMS is really our biggest department or system that we work very, very closely with. We meet with them regularly. We do have there's a loop closure with them as well. If they bring us a patient, we like to let them know how the patient is doing moving forward. Also, the acute rehab, we have rehab physicians in the hospital that come and evaluate patients if they're appropriate for our rehab department. Do you want to talk about a few other ones?
Yeah. So during the course of their stay, of course, they'll be evaluated by therapy to determine what their needs are when they go home. And our case management department, those are trained nurses who, gather all this information and will put referrals out as needed, whether it's our acute rehab, which is right in our hospital, or maybe they need home care for a while. And even if they come to our rehab center, they will be discharged with home therapy. And then I always joke they graduate to outpatient therapy so that they continue to receive services to help them adapt back into the community. The other thing is the hospital works with a company called 101 Mobility that they can refer to them to make adaptations to their home so that if they now need bar something to help them, like getting off the toilet, a toilet raiser, or bars for the shower, or maybe a ramp or handrails to get into their home, they can help work with that. And then there's also something that we're looking at bringing to our outpatient therapy. It's called Vivistem. So it's new technology. I had not heard of this, but we also have a stroke survivor group, and one of our members is just emphatic about this. He had this Vivistem placed and just talks wonders about it. And what it is, it's some FDA-approved technology that is able to stimulate their vagus nerves so that they are able to have 2 to 3 to more times limb restoration after a stroke. So
almost like a nerve stimulator that actually, if your arm is weaker, you put this device on. Actually, your arms become stronger, so you can actually use your arm more effectively. So it's kind of amazing technology. Also, I want to point out that in addition to having inpatient acute rehab unit, we have outpatient as well. And there's a small subdivision of the outpatient we call mobility lab, specifically targeting stroke patients, where they actually come and continue that inpatient rehab to outpatient basis as well.
Very good. So again, we're seeing that technology and the innovation. It's growing when it comes to treatments. You already mentioned here, you've definitely recently adopted a lot of these really great new technologies that are there to help these patients out.
Right.
Yeah, I just want to also point out, as I was thinking about innovation and technology, one thing that we did a year or two ago is we switched the medication that we were giving for the clot dissolvement. We went from the TPA to TNK. We did this. We were kind of early adapters to went to the new medication because it decreased the time how quickly we could deliver the medication to the patient. Because the first medication pharmacy had to mix it for us, and you lose about 15 minutes there. And right time is brain, so we want to decrease that time. And then we went to this new medication where nurse can just come into the medication cabinet, remove it, and draw it, and give it to the patient, so decreasing the time. It's being early adapter for this new now it's FDA approved for stroke, has been also instrumental for us as well to continue to improve the stroke care that we provide for our patients.
Absolutely. We have about roughly a minute and a half left here. I know that we did discuss through most of the things here. Just real quickly, though, I know that there is the post discharge support. So, how does St. Joseph coordinate post discharge care and self care education for stroke patients to help prevent readmission or complications?
So we have very targeted stroke education, and that's actually something we are measured on with the Joint Commission, that every patient receives education based on their needs. You know, if
Hmm.
they have irregular heart rate, that's what we need to teach them. If they have high cholesterol, that's what we have to do as well. So in addition to having support groups, stroke support group on our campus, where actually patients are able to come back and support each other, and then referral to other agencies such as home care, different things like that. I just want to point out as a
Hmm.
quality, we are get with the guidelines. We have received a couple of different awards because our outcomes are so good.
Hmm.
We have received get with the guidelines honor roll for diabetes and gold plus for stroke care.
Awesome.
And the diabetes one, the important thing to note is
Hmm.
over half of our patient population last year that came to us, they were diabetics
Wow.
that had strokes.
Wow.
So really something for
Proud
our
of that.
diabetic patients to remember to take these symptoms seriously, and that we made the honor roll through the American Heart Association.
That is awesome. Well, I thank you both for joining us today. This does run out of time here, but folks, if you want to check out more information, stjosephelgin.com for more information on their website. Check out more. Again, get that quality care for your complex needs. Don't wait. Stay tuned. We'll be back with more in just a bit.